Sure, not a problem. You're all set up. The recording is started. The YouTube live is started. And whenever you're ready, the meeting will continue.
Not a problem. Thank you.
No problem.
Hello.
We are here. We're just waiting a few moments for Elaine Mahoney to come on in. I just sent her a text message.
Okay.
I'm going to give it to 5:15. Good evening, everybody. Can y'all I can't see anybody but myself and Kim. Hello.
Hi, Kim Robinson from Councilmember Samuel's office.
Miss Samuels, I feel like I see you. I feel like we work together. How many times already this week did I see you? Miss Paul, are you with us? I see you unmuted.
Yes, I am.
And Miss Carmichael, are you with us?
Yes, I'm here. Hello.
Hello. How are y'all doing? I'm Tamika Gibbs, the co-chair of the Health Committee. I'm the co-chair of the Health Committee. Elaine Mahoney, I haven't heard from her, and I called and she didn't answer, so I'm assuming she's probably stuck in the middle of something with children. I sent mine somewhere, so I don't know where they're at. Does anybody have an announcement before we start? I know Ms. Kim always has an announcement.
So I'm not even sure what's happening with so we had a couple of toy drive events with the 73rd and something over, but I'm not even sure right now if that's still on. So I was trying to get some information from the office, but I have not got a response yet. So I'm not sure if the event's still happening. I know there is it's called Carolyn on the Hill. It's Bright Light Church right there on Park Place and Ralph. It's supposed to be Carolyn Hot Chocolate PP, and that's going to be at 2, I want to say 5 o'clock, but let me try to get the information before the meeting is finished.
Thank you. So I won't even write anything down. Also, this meeting is live. I'm not sure if y'all can all see in your top corners. I'm actually on my phone right now. But it is live, and if I'm not mistaken, it's probably being recorded. Am I correct?
Yes, it's being recorded.
Okay.
That is correct. It's being recorded, and it's also simultaneously being live streamed to YouTube as my backup to any technical difficulties with obtaining the recording.
Thank you. Oh, we've come a long way. We're live streaming on YouTube now. Do we have any announcements from any other public officials before we proceed with our meeting? Good evening, Miss Wars. You're muted. You were saying something, Miss Wars? You're muted. We can't hear you. Unmute the phone or whatever you're on.
My
yes, there we go.
I was trying to get off of a phone call.
Oh.
I was trying to end the call so I can, focus on the meeting.
I'm sorry. I just seen your list moving. Good evening. Welcome to the Health Committee monthly meeting. Ms. Mahoney, our chair, is unavailable, so I'm the co-chair, Tamika Gibbs. Just to let you know, in case I was on last month's meeting, but I wasn't visual, as I was actually physically driving. Do we have any other announcements before we proceed? I guess not. Just to recap, anybody that's here was here last month. We set our objectives for the year 2021.
I think I missed the last meeting because I think I had my times confused because I saw one time said 6 o'clock, and then when I logged in, I think it was already over. Then I checked my email again. It looked like it got changed to 5.
Yeah.
So that was my fault. Yeah, it was a busy work day though. So it was hard for me to stay on top of it. But I did miss the objectives.
Okay. We had a few. Hello.
Oh, I was gonna say I was here. This is Nyasha.
Hi, Nyasha. I'm glad you said your name because I think I'd have mispronounced that all across. So I said Miss Carmichael.
Yeah, that's fine. Yes, I was at our first meeting last month. So yeah.
Thank you for returning. Just as a recap for those who weren't here last month, we went through a few objectives and what should be our concerns for the 2021, excuse me, upcoming year, and what our objectives and what things we want to focus on under the Health Committee. We presented to the full board last Thursday. Our 2 main objectives that we've all agreed upon, that's on everybody's mind, is of course mental health and financial health. COVID is everywhere. It's impacting everyone, and we get a lot of physical health from the news and all the other outlets, but people really forget about the mental impact as well as the financial impact that COVID has provided to many people in the community. We've had a few people last month, a few visitors actually. We're trying to set up presentations, trying to have I'm sorry, I have a brain fart. The first half of
Thrive NYC. You guys had
Thank
one
you.
them.
we had we were focusing first on mental health because of course the holidays, a lot of people have lost family members due to the COVID, as well as a very big strain normally without a pandemic going on. So we're trying to do the first quarter of next year, January, February, and March, simply focusing on mental health. April, May, and June financial health, because of people's tax season. We're trying to have a few presenters. I don't know if I wish I would talk to her to know what was coming up for this meeting, but anybody have any suggestions? I know thank you for reminding us of Thrive, but we actually trying to set up a presentation for Thrive. And there was another person that was here at last month's meeting for another program that's not just Thrive, but another agency that can help people with mental health and focusing on what we can do to focus on the mental health to get us through these times. Do anybody have any other suggestions?
Can I go?
Excuse me.
Can I go? Can I share?
Share. Yeah, share. Share.
Kim,
I'm writing. I'm listening. I'm just writing.
Okay, yeah. My name is Kim. I'm actually a licensed social worker with the New York City Department of Education, and I actually am employed through the Thrive Initiative. So I'll be down to do a talk or some sort of presentation of some sort. I specialize in children and families, but I can do stuff for adults, any age group or dynamic we want to put in. And I know a girl. She used to be a director of operations in the DOE. But now she just she has her own finance company. She's a Black girl, really smart. She lives in Carroll Gardens on Nostrand, and I know she does go around and do a lot of like financial wellness type of things. So I can definitely reach out to her about that.
If it's possible, can she actually can you get her information? We're trying to set up for the financial part, especially we trying to do that after we do the the mental health presentations, because we're trying to get more people to come to the meetings. We don't have a presentation, and it's just 5 of us. I think it's 5 of us here now, 5 or 6 of us. We're trying to get it out to the masses because it's something very important. A lot of people take it for granted, but a lot of people are suffering. It's not just with COVID, but it's a lot of things attached to COVID. And this is a time where a lot of things go on, mental health in many communities just around the holidays. So we're trying to attack that as well. Because everybody talking about, eat right, work out. We were concerned. That was one of our big concerns. One of the 2 objectives we're trying to learn on. Bright Light Baptist Church. Okay, I've seen that. I'm sorry. As stuff pop up, I'll read it. So I'm going to ask you, can she come to our next meeting? So we can probably settle something with her as far as scheduling wise. And we will definitely probably have, that's about to ask something, solidify a date, a meeting, whether it's the January meeting or the February meeting, for you to possibly have a presentation for kids, families, just from a social work perspective. That was also always a good, I'm sorry, I'm writing. Thank you. Anyone else?
So wait, so just one question about the girl who does the finance stuff. Did you want her to reach out to someone or not right now?
Sorry. I'm sorry. What was the question?
Are we going to table that till later, or
No, I would like to have her actually come to next month's meeting, so she can actually tell us what her schedule is. I know if she's into finance, usually tax time is probably her busy time. She won't have time to talk to us. I don't know, but we don't know. I don't know what her schedule is. So if I would ask you to implore her to come to our meeting for January. Kimberly, can you please put your information in the chat so we can have it? Because I'm doing a lot of things right now.
Yes.
So we can have that information. Julia, stuff in the chat will be recorded as well, or no?
And just before the meeting is adjourned, please just remind me to save the chat files.
Thank you. I'm putting at the top, save chat. I'm
sorry, at 6 o'clock, I have another meeting I need to jump on, so I'm going to be multitasking at 6 o'clock if this is not completed. But Ms. Gibbs, I was also thinking a short while ago, we had a very active non-member resident, Celeste Farmer, who worked with NAMI.
She's actually my neighbor.
Okay, so Ms. Farmer and I have had many conversations about what NAMI offers, and she gave me a lot of great information that over the years has found its way into the newsletter. I think maybe a representative from NAMI would be a really good partner for this committee, especially in terms of mental health issues. As you alluded to earlier, COVID has exposed many crises in terms of mental health. We can no longer say mental health is not an issue we can afford to have, or this is what I've been told, it's a white people issue, I was born depressed, etc., etc. No one can actually say that. We can no longer ignore it. And I think it's I think it's time for us to actually start paying more attention to what the long-term health effects of COVID might be outside of the physical, because especially Miss Watson, you work with kids, so you know that these kids are suffering right now. So it's time for us to start brainstorming and maybe start helping to direct the city in terms of where they should focus their funding and programs and derivatives, et cetera, et cetera.
Yeah. I have a lot of children who were or teens who were very much into sports and stuff. And now when I run into their parents in the community, or I get phone calls that now they're smoking weed, because all the sports and activities are gone. So yeah, definitely something to look into. And then I was thinking about the New York Center for Psychotherapy. They work with children, families, and single individuals, adults. They have an outreach team that will go around and present also. So I can reach out to them to see if they want to team up with us.
Also, we should start looking into some holistic effects so that people can do work on their own without, medication and psychotherapy. And I'm specifically referring to meditation and mindfulness activities right now. Those are very beneficial. A lot of people are turning to them, like the Calm app and the Gaia app, et cetera, et cetera. So far, people seem to be taking to them, but not enough people are focused on those components in terms of affecting your mental health.
Yeah, I think when it comes to mindfulness and stuff like that, you have to put it into practice for people to really get it. So usually when I open up with mental health, we'll have a mindfulness moment. We'll open up close with a mindfulness activity, and then they can kind of get walked through how to use it. And then they kind of get the feel for it, the benefit of it. And then, now that they know what to do, they can practice it on their own, even deep breathing. A lot of the reason why people smoke is because it's deep breathing, right? It's relaxation, but it's unhealthy. So just, making those connections with people.
Absolutely, absolutely. And Ms. Gibbs, you can have your meeting back. I'm going to sit back and shut up.
No. I was actually, when you were talking to her, I was actually talking to Ms. Mahoney. She's actually upstate. She lost power. That's why she's not here. So I am here, but she's also here as well. I think she probably just joined in the meeting. I'm not sure if that's her. Whoever just joined, please, if you can say something. That was a phone number I just saw pop up. I'm not sure whose it is, but another number. Hello, number ending in 32. Okay. So that's why I was just listening. Is it Wars? I heard Miss Julia say Miss Watson. Miss Wars? Miss Wars?
She's muted.
Yeah, Kimberly Wars, can you unmute?
Oh, I'm sorry.
It's okay. It's okay. It's okay. If it's possible, since you seem like you do, you've already done these presentations, is it possible you can return to our meeting? I'm sorry, I gotta move over to the light. I'm losing battery.
She's a committee member. She's one of our board members. She's a newly appointed. Well, I can't even say newly appointed. She was appointed in May,
Okay.
and she's on the committee.
Okie dokie. Oh, so this is your first, that you did say this was your first meeting. Wasn't sure. Are there any other board members on this call?
Yes, I'm a board member.
Audrey Tate Hall is a board member.
Yes, I am.
I really wish I had my computer that I could see
And
everybody.
Ms. Tate Hall was one of the initial members of the health committee under Quasi Menza. So I don't think she was on last month, but she might be able to give the committee some type of updates of what Mr. Menza had been working on before he was removed from the board.
Well,
Okay.
it was basically trying to find out if they had stepped up and opened up more places for the testing, for the COVID testing. And that's the last thing we spoke on.
I'm sorry. I'm
That
multitasking.
was back in March, COVID testing, March and April COVID testing. So yes, to answer your question, Ms. Tate Hall, the city does have a number of free testing sites with Health and Hospitals Corporation. They also have, in addition to the fixed locations, they have what I call the floating locations weekly, based on neighborhood hotspots across the city. There are, I believe, about 25 or 30 HHC testing sites across the 5 boroughs, with another, like 10 floating sites or so.
Okay. Because I mean, basically, when I'm out, right, most of the sites that I see are terribly crowded. Some of them, the lines stretch 2 blocks or more.
Yeah, that's usually for City MD, because a lot of people don't want to go to the HHC sites, but the HHC sites with the city, where the New York City Department of Health actually does the testing, and they get the results for you. They process the results. There's very short wait times in those facilities. I've gotten tested 4 times in the last 2 months. I get tested every 2 weeks. You guys know your status. Know your status, okay? Go back to the early and mid 90s, HIV testing. Know your status. Stay safe. Keep your family safe. I'm usually in and out in 15 minutes or less. I've never had to wait more than 20 minutes for a COVID test. And also, half the HAC sites, not only do they do antibody testing, but they also have the rapid test where you get your results in 2 hours. So if you do see people standing in line, this is for everyone on the committee, everyone on this call. If you do see people standing in line for a City MD was not set up for COVID testing, and that's why they have such long waits. Please encourage them to go to their nearest HHC site. They are all over the city in all 5 boroughs. They are set up with Health and Hospital Corporations. The New York City Department of Health is the one that actually does that. They help you with the results. You go into MyChart, you get your results in 24 to 36 hours, 15 minutes or less. That's all it takes. Please encourage them to go, and it is free.
But the antibody test is not free.
With HHC, it is. If you go to City MD and you want to get an antibody test, then your health insurance will be billed. Or if you don't have health insurance, which a lot of city folk don't have currently, due to the rapid unemployment, the high unemployment rates, then you are charged however much they charge you. But with HHC, it is free of charge. I mean, you can't get an antibody test every 2 weeks like you can get a COVID test, but it is it is free.
Yeah, I was expecting them to keep repeating that test, but some of the people I spoke to on the line, I says there has to be something, less, because it's not only City Med. It was there's another place. I can't remember. It's not Wellness. I can't remember the name of the other place. It's on Flatbush, but basically, they're pretty crowded. All of them are pretty crowded. So I, needed to find out if there was something else out there. Thank you for that information.
Okay. I also want to implore everyone who doesn't have access to the 301 app, go online to 301 nyc.gov/301. All this information is posted. All this, the COVID testing sites, the HHC sites, all listed. Bob, you can actually put your zip code in. It'll tell you the closest testing location via HHC close to your zip code.
Okay.
Okay, I'm in the middle of. Miss Mahoney said that we had I'm sorry. Miss Mahoney said that we had Thrive New York City scheduled. I'm trying to wait for her to give me a date on when we had. I don't remember the date on that. I'm trying to figure it out. But is there anything else? I know it's not today because Thrive is not here now, so I'm assuming it's not today's meeting.
Mm. And Thrive is Mrs. De Blasio's thing.
Correct.
right?
That's her mental health initiative through the City of New York, the Department of Health. Yes.
Because they have been on the radio, on the TV, not Thrive themselves, but many doctors have been really concerned about people's mental health right now.
Yeah.
And you're
That's
right,
why.
because of, the holidays and,
Yeah, it's already a spike during the holidays for mental health incidents on a
mhm,
normal conditions, but of course, being under current conditions, and just you can have not even had anybody have lost anybody during this time, but just being here, especially in New York, we had a rough start. Like we had a rough start, so that
mhm.
plays a lot on people's
Yeah.
mental.
And in addition to COVID, the election was a lot of issues with the social justice. It was a heavy year. It was a
Very
heavy
heavy
year.
year.
Even the tragedy of Kobe Bryant, there's a lot that just happened. Like,
It was
very,
like
very,
a snowball
Yeah,
effect.
it was a snowball. Yes.
It was one thing after another, unfortunately. Um,
And I hate to get up every morning and I say, okay, what's next?
I don't
Oh,
even act. I just start working on my computer.
yeah, I feel like I'm a little worried about my own self because I've been dealing with so much death. Like, and I haven't processed anything because it's like a new one, and then a new one, and then a new one. So I can't even like settle the first couple of losses that happened. Like, it's
That's unfortunately that's many people's echoes. I can say that personally for myself. I've buried two family members in less than 30 days in April, and I my entire family haven't even gotten a chance to grieve yet because it was like one after another. So it's like okay, like we had a breakdown over eggnog of Thanksgiving. Like that's how fragile my family is. Like simple thing as eggnog is like okay, but anyway, so my mental health as well. Like literally, um, so we want to get. I don't know when Thrive is supposed to come, Miss Mahoney. I don't know. I guess she said told me she's upstate and they lost power. So I'm quite sure her signal is sketchy up there as well. So I'm going to Miss Wares. Can you possibly be ready for a presentation for us next meeting? I Miss Miss Julia, can you save our chat? It's 5:30. I know you're getting ready to go, but I tell you
Oh
before
no,
6 o'clock.
it doesn't start until 6. I wasn't going
I know. I'm just remembering.
until 5:55. Set up.
Okay, no problem.
But
So
if
can
you're
you?
getting ready to adjourn, I will gladly save the chat. It's not a problem. I will,
No.
double save it by copying and pasting it as well. I believe in redundancies. Okay.
Listen, that's how I get things in my head. I got a lot of stuff going on, so that's how I remember stuff.
Okay, so
Um,
your chat is saved, and at the board meeting, I don't remember if you guys, I don't know if any of you guys were present, but there was a lady from that she was talking about the bees and stuff, and some
yes.
local laws that are being proposed in the city council, and basically the thing is that they would like to. Well, I spoke to her a couple weeks ago, and she would really like to make a presentation before the committee. Miss Tate Hall will tell you that beekeeping and naturalness and holistic healing was something that Kwasi Mensa was really big in. And it's actually something that, maybe the committee should consider continuing, because holistic healing is very valid for some people. But the bee legislation, I was looking into it, and it is actually very important, because a lot of people don't know where their food is sourced from. And without knowing sourcing, it's really difficult to continue eating cleanly and healthily. Like, I don't even know how many people know that on Tuesday of this week, the FDA approved genetically modified pig.
Yeah, I did
So,
get that alert.
Yes.
How many people are now going to be like, all right, no more bacon for me. I'm one of them. So
I don't eat it.
I'm one too. I was holding out, but when I saw that, I said, "Oh no, that's it."
No more bacon for me. Earlier this year during the pandemic, I think it was in like July or August or something, they allowed cancerous animals to be harvested for their meat, and all the slaughterhouses have to do is cut around the so-called tumors, and so people really need to know what's in their food and where it's coming from. I don't care that it's legal. If people understand more, they'll expect better. And I think it's one of the responsibilities that we have as a health committee, focused on overall health, not just physical health, but like a lot of the things we eat. If any of you, if you go out and eat nothing but Twinkies and Ding Dongs for a full day, or McDonald's, you're gonna feel like crap mentally. So what you put in your body does affect your mental health as well. And people need to understand these connections, and I think the role of this committee could be one such as it could be a catalyst for information and understanding. And I'm really hopeful, and that the committee will take on more of that type of role to support me in my efforts of getting this type of information out in the needs statement and the budget document that we produce every year, and also just to get more information to the community. Knowledge is power.
What we used to do is one Saturday we would have a health fair in one of the publicly run gardens, and the next time we had a health fair over at oh gosh, I forgot the name of the place on Sterling, where we invited different vendors to come in, and they made their presentation. And the thing with the garden, I don't know if that's the same young lady that came. I can't remember her name, but she did a thing on raising bees. Kwasi at that time started raising bees in his backyard. I'm not that courageous yet, but it was something that we were well, vested in. There was another member. I don't know if he's around. Julia, what was his name? Noah, and I.
Noah Potter. I believe you're talking about Noah Potter, and he was very big on legalizing marijuana and the use of CBD as holistic healing mechanisms as well.
I'm not big on that, but his wife was big on beekeeping and plants like I am. Are they going to be coming back to the committee, or they're,
I do not know. We've been sending out the health committee meeting notices to the entire mailing list, trying to get additional support and participation. Unfortunately, which is why the committee really needs to do its best to get information out there. People really don't look at health as a major issue unless you're old or sickly, and
or it's too late.
Exactly. As Ms. Muhammad says about the seniors committee, you don't have to worry about senior issues once you turn 65. You need to start worrying about them way sooner than that to start preparing for it. And it's the same thing about health. An ounce of prevention, goes further than the remedy of whatever ailment you have. Don't get the ailment. A lot of these things that people are getting, diabetes, high blood pressure, hypertension, all of that stuff is entirely preventable. just by watching what you consume. So this is the stuff that we, as brown skinned folk, we need to start focusing on. Not trying to exclude white people from this conversation, but we do need to get this word out. And I believe Eric Adams, Borough President Adams, has been trying to do that with the veganism and vegan diets. I don't think people really need to go to that extreme. It's all about healthy eating, though. But in order to eat healthy, you got to know what you're consuming. You got to know what you need to look out for.
Yeah, well, you know what? He is very, very much correct. Because when I changed up the things that I was eating and was more into a vegan, my diabetes was like null and void. But since the pandemic and things weren't totally available to me, right? I'm back on the diabetic list.
Yeah, I totally get it, Miss Tate Hall. Prior to the pandemic, I was literally about 80% toward vegan myself, and I became a raging carnivore once COVID started. So, the weight that I had lost prior to with the healthy eating and like not consuming animal flesh, I started gaining back immediately. Once I started eating flesh products. So, it goes to show that knowledge is power, and you can really help yourself by knowing as much as you can know about, and without sounding pretentious and like a know-it-all, knowing as much as you can know to make better choices for yourself. And I hope that the committee would start looking into getting that word out, because we need help as a community.
Yes, because come on, look, now they claim they found this vaccine. How many of us are willing to take that vaccine? And with our rate of diabetes, hypertension, it's like,
The mere speaking of a vaccine that's only for emergency use gives me stress right there. Nobody's listening to the fact of it's for emergency use only. Vaccines are not for emergency use.
No.
People are not listening to what they're talking about. But anyway, that just gives me stress. That affects my mental in so many ways that it just gives me anxiety. People are like, oh, I'm lining up. Did y'all not hear what it was approved for? It was not approved for everyday use, everyday vaccination. It's not. That means emergency use. That means they're still testing it. And guess what? You're lining up to be their test subjects.
It takes almost 10 years to develop a vaccine very well. So I don't know how this popped up overnight, but it usually takes years to develop a vaccine.
They have to learn the vaccine. They have to learn the virus that it's trying to cure. They haven't done that.
Here's the thing that had me really upset. What are those guys that come on? Every now and then I catch them. TMZ. They brought this doctor that claims, a Black doctor, who claims that she has been working with COVID for 20 years. My antennas went up, right? 20 years. So you mean to tell me that there is some truth that this thing has been around?
Oh, yeah.
It has been around.
Yeah.
Okay.
My mom said she learned about COVID when she was in nursing school in 1990.
Okay.
Miss Cable, if you look on all of your your Lysols and stuff before COVID came around, all your disinfectants, it names everything that it kills. And human coronavirus is on there.
Yes. So this is why I'm sitting here saying, well, all right, now why is this now such an emergency?
Okay, wait. Okay, I understand where this is going, and I agree with you guys, but there are literally 4,000 different species of coronavirus out there. The flu is one of them. Pneumonia is another one. SARS is another one. The reason why they call this the novel coronavirus is because this one specific genetic markers we have not seen before. But in terms of most of it is DNA, like 90% of its DNA, it is a standard coronavirus, which is why like Lysol and stuff will kill it, which is why we know that washing hands will kill it. But there are certain things about it, like the way it replicates with RNA versus, just getting into the respiratory tract. That's what makes it so
That's it right there. From a DNA to a RNA, something.
No. The RNA
No.
is how it replicates in the body.
Yeah.
It would spread. It's
Okay.
not that it has nothing to do. I mean, yes, every living organism has DNA. So
Right.
can I tell you, like, human DNA and an amoeba's DNA, it's about 70% the same. So
Okay.
we all have a lot of genetic markers that are very similar. Like humans can get pig hearts because the DNA of a pig is very closely related to a human. I'm sorry, I'm a science major. I'm very much a nerd. Please don't allow me to nerd out. But I can say yes. There are 4,000 different species of coronavirus out there. There is truth to what this particular doctor has been saying about working with coronavirus in the 90s. There's truth about what the Lysol can says. I'm not going to dispute any of that. But please, let's not forsake our own mental health by falling victim to these conspiracy theories of, oh, they knew about this. That's why the vaccine is coming out so quickly. As Ms. Gibbs said, let's learn everything about this virus that we can first before rushing to this vaccine. I still don't think that, there's enough understanding about the virus. Remember, when it came out, everyone was saying it was a respiratory disease. It's not. They're finding that it's more circulatory than respiratory, and I'm sure in a couple months, they'll find that it might not even be circulatory. It might be lymphatic. It might be something else. So, exactly. That's the scientific process, and that's just how it is. It's just under normal circumstances, the general public wouldn't see the scientific process being played out on the news every day for 9 consecutive months. Welcome everybody to the start of month 9 of the pause, the great pause of 2020. It's officially 9 months today. It is the cycle of a human gestation period.
You're right. You're right.
You are right.
We can start seeing. I guarantee you, there's going to be a lot of babies vying to be the first New Year's baby this year. Well, for 2021. Yeah, and I'm curious to see how many babies will be named Rona.
Oh my goodness. Oh my goodness.
Rona or Corona.
And I think Miss Robinson is tired of our dinner conversation, and if there's nothing else that the committee really needs to discuss aside from maybe future speakers, we've identified Miss Watson is coming back to make a presentation on Thrive. I would reach out to Celeste Farmer to see if she can get someone from NAMI for us. And you guys can let me know any other speakers you would like to invite, any other information you would like, and I can start researching just to help the committee get some bearings underneath it. But let's let Ms. Robinson go because I kind of
she may have an announcement. She may have an announcement. She said she might. Oh, you put it in the chat? Oh, okay. Thank you, Ms. Robinson.
Yes, Bright Light. She gave the information for Bright Light. Okay. Thank you so much, Kim.
So much.
There was some information for seniors. I'm not sure if you're aware that the city have a snow shoveling program for seniors. They can either call 311 or they can go online at nyc.gov for those seniors who are homeowners.
Oh, okay. I will send out an e-blast. Do you have any more specific information for that?
Me. That's for me because my son took.
I'm gonna send it over to you. Right. I'm gonna send it over to the email.
To the boards. Thank you so much. I appreciate it.
Okay.
Okay, and you can send it over to me because my son took sick early today. So my steps are half shoveled, my sidewalk is half shoveled, and my entrance is not shoveled.
Okay, Miss Julia, can you save the chat files again?
Yes, it's saved, and I will when the meeting is ended, I will remember to save the files from the meeting. And I hope everyone hops on to the next meeting with the HPD report back about those 2 lots on Bergen and Dean. Yes. It has been turned into a health-related issue, so it's very closely related to this committee. So,
may I ask a question?
Yes, ma'am.
Just being a new person, I
heard. You ain't that new.
But I just heard something important, like, because our committee does sound like we have an important role, but it sounds like we need to like get more out there. But I don't know, like, how do we like do that? Like, how do we put out there more of what we're doing?
Okay, so I can tell you that the seniors committee, when Miss Muhammad took it over, it used to be the aging committee. They didn't have a lot of membership either. How she built up the following for her committee is literally by getting presenters on topics that people really cared about, or interesting topics that people didn't know they cared about until they realized how interesting it actually was. So that is, I mean, starting with Thrive, I think once we start publicizing and making the flyers about the Thrive presentation, can I tell you, a lot of people realize mental health issues are a real thing right now. As I said, there's no more saying it's not an issue that we can't afford to have. You can't say that no more. No one's saying, immigrant communities are like, no, that's an American problem. That's a white American problem. No one's saying that right now.
No,
you can't escape it. Okay. The fact that COVID fatigue has become a staple of speech on the news right now, that is a mental health issue. COVID fatigue is a mental health issue. So there's a lot of things that this committee could be focused on that will generate interest. It's just a matter of me knowing in advance so I can get a flyer out for you and get it circulating through the community. Ms. Tate Hall said about the health committee back in the day. Yes, they did. They did have every year an annual health fair, and it was not very well attended because no one cared at that time. People care now. So you guys have an audience. People are paying attention. They are listening. It's literally just about finding what people want to hear and then giving it.
I would have called to have the city clear.
Thank you.
What?
Okay. So that is that. And I don't so Miss Watson, are you going to be the presenter for Thrive next month?
I definitely can be. I just don't know what people are interested in hearing about. But I definitely can be. I don't mind.
I mean, okay. So one thing, this is my own personal thing. I'm sorry. My one of my masters is in sociology, so I really care about this stuff. If you can give me some statistics on how many people are calling the Thrive hotline or the suicide prevention hotline, I would really appreciate it. That it doesn't have to be part of your presentation, but I just want it for myself because I'm a nerd, as I said.
Okay, I mean, we can include data, but I mean, I think something like this more like community facing. That can support
Yes. Anything tangible that you can give, any numbers that people can have, where people can go for in-person therapy. I'm proud to say that I've heard a lot more people getting therapy now because it's available online. They don't have to worry about to go all the way out there. It's just like these meetings. If we were meeting in person,
like a psychoeducation route where I'm kind of probably teaching them like this is how you this is what anxiety is, this is what depression is.
Yes. Also, anything about recognizing mental health ailments. A lot of people think depression is just sadness. Depression can manifest itself in many different ways. It can manifest as anger. It can manifest as promiscuity. It can manifest as self-harming, anything like that. But the umbrella is depression. Anything tangible that people can get, any assistance that they can get. It's, as I said, the mindfulness, the meditation. If you can start talking about the triggering things that can help trigger, any type of spiral and mental health conditions or whatever. Talk about what causes it. Trauma is the cause. Anything. You're the expert. I'm just.
There's so much content. They could be like 2 different presentations, like 2 different full presentations, like a trauma-focused one and one more psychoeducation.
Well, that's something that Ms. Gibbs is co-chair of the committee, and Ms. Mahoney, you will have to speak with them on that about what they want. I agree with you. This is definitely something that Thrive can come back multiple different times. Different organizations can come back
all year long. I mean, several times.
Yeah.
I think we should first start focus. I mean, I think the first Thrive presentation should simply be on trauma. We've all suffered the trauma.
Yeah.
We've all suffered the trauma. Exactly. That we're still living through.
Traumatic event. Absolutely, Ms. Gibbs. Absolutely.
I got that. So in the next meeting, do you guys want me to show you guys the presentation? Is that what we're doing?
Yes,
Okay.
yes. Can you submit the presentation? Miss Julia, I have a question.
Oh, you don't have to call me Miss Julia. We the same age, Miss Gibbs.
And I've always called you Miss Julia for how many years now? Anyway, and you always call me Miss Gibbs. Anyway, I was asking Miss Mahoney this question. Since we don't have a large group here, well, during our last meeting, is it possible during our, this is the question, I know you have another meeting, at our general board meeting, is it possible for our report, for our health committee report, we can do a snippet of the Thrive presentation? Is that possible?
I put it this way. I will ask. I was speaking. I need water. I was speaking to Ms. Tyus today, and the exec committee wanted to discuss potential speakers. Thrive was mentioned. I will ask Michelle if maybe for the full board, because as you know, that's what we've done. If something was particularly interesting,
Yeah.
we invited them back to the full board. So I will ask Michelle if and Thrive was actually supposed to come to one of the meetings when the pandemic started. So, you know, it's, that would be ideal. That is not a problem.
As a wider audience as well.
Exactly. You know, during the virtual meetings are getting double and triple the participation of in-person meetings. So I'm hopeful that when it's calendared, it will reach, 200 people versus, 6.
Gotcha. Is there anything else? Because I know Miss Julia has another meeting at 6 o'clock. Do we have Miss Watson doing a presentation on next meeting on trauma? We're starting off with trauma.
Is it going to be the committee meeting or the full board meeting?
At the committee meeting. We're just going to start the committee next.
Miss Watson, I'll be in touch about a full board meeting. Okay.
Is your last name Watson or Wars?
Watson.
Okay. Your thing says Wars. I asked you that earlier.
I don't know why it says that. It was a typo, probably. I'm sorry about that.
Okay.
All right. Well, have a good night, everyone. Hopefully I see some of you on this next HPD report back meeting about those 2 HPD lots on Bergen and Dean and Prospects Heights. As I said, it has been converted into a health issue because of the density that we don't know what they're proposing, but the density of that area down there, since it's in the footprint of Atlantic Yards.
Thank you, everyone.
All right. Have a good night, everyone.
In a bit.
Everyone.
Everyone, bye-bye.
Good night.